Hello everyone. So today I am here to discuss a new topic called as a prescription medication order and communication skills required by a pharmacist. So we'll discuss one by one what is the prescription medication order. Here, prescription medication order, it is a written direction, of course, by the physicians. A physician will write the prescription and there are different parts in it. This is a legal document. Without of this, any medication is not sold. So, the prescribing practitioners may also give a medication order verbally to a licensed person. Sometimes what happens, a practitioner is giving a verbal information about what a therapy should be given, and this information is given to the licensed person. This person could be a pharmacist, this person could be a nurse. And having a prescription is mandatory, as I told you, to purchase drugs online as well as to the retail from the retail outlets. This is illegal to purchase or sell medicines without a prescription. So it's very important when a patient want to buy a drug. At the time, it's important to have of course, medication order. This is all written by the physician. Now, there are some of the parts. A physician's order, there is a second name, we are calling this as a physician order. So, medication order is also named as physician order for the preparation and administration of a drug or any of the device for the patient. Of course, they are for the treatment of any of disease or patient's problem. So, a prescription has several parts. There are 4 parts basically. What are these 4 parts in the prescription? One is the superscription. Another is inscription, part number 2. Part number 3 is the subscription, and part number 4 is the signature. Yes? So, subscription part is with the symbol RX, which stands for the word recipe. So, there is some information, and this information is related with physician. So, this information is written at the RX part. Inscription, which contains the names and the quantities of the drugs which is prescribed for the treatment. It's written in the inscription part. There is another part called as the subscription, part number 3, where the direction for compounding, how to prepare the drug, how to administer the drug, it is written at the subscription part. Another part is called the signature, which is often preceded by the sign S and signa, giving the directions to be marked on the container. Like there are some of the storage conditions, so it is written at the part of the signature, last part. Now this is the format of the medication order. We can see this is one of the medication order, and what is written here, see, this is RX, number used by the pharmacy to identify prescription number. There is a refill. Refill means number of times a patient can reorder the drug. So, refill is written, doctor's name is written. This is all the part at the part number 1, RX. Now, another is, we can see here, medication is given, metformin HCl tablet 1000 mg. It is for the treatment of diabetes mellitus. So, this is the part of the inscription. What is written? The dosage, 1000 mg, dosage form, tablet and a drug. So, it is written in the inscription part. Another is, there is called as a subscription. So, how a drug should be taken. So, it is written, take 1 tablet by mouth daily. So, this is the part subscription, and all the information written here at the last is called as a signature. So, here the information related like caution, what should be the precaution. Federal law prohibits the transfer of this drug to any person other than the patient for whom it is prescribed. So, there are some of the precautions when it should be discarded. So, this is the information which is related with the part number 4. Now, there is an interpretation part, as there are many prescription orders and some of the abbreviations are used in the prescription order. What are these abbreviations? So we'll discuss. There are many more abbreviations, but we have just taken some of the examples here. Like ADLIB, this is one of the abbreviation. This means when it is needed. Similarly, this is very popularly used BID. So means twice a day. If any formulation is taken 2 times a day, it is written like BID. Similarly, PRN, as needed. Q means every. So there are terms like Q3H, Q4H, means every 3 hours, means every 4 hours. So like this. So there are many more. Similarly, there are other abbreviations. AC means before, means if any formulation or any drug is taken before food, it's written like AC. H is horosomny, means at the bedtime, which is taken at the night when a person is going at bed. So like this, there are other interpretations also. Some of the interpretations like CAP means capsule, GTT means the drops, like it is written for the eye drops and ear drops, like this. And there are other like this, these first, second, third, and like this. So these are showing the number of doses. Then mg showing milligrams, and similarly ml for milliliters, S is for 1/2, tablet, this is the tablet, this is for the tablespoon, this is for the teaspoon. This TSP is the teaspoon, TB is the tablespoon. So like this it is written as an interpretation. Now there are other interpretation. We can see the examples. These are the examples with AD and AL. AD is for the right ear, AL is for the left ear, C or O means for the width. If we have to use the width, we can use this term C or O. OD and OS, it is for the eyes. OD means the right eye, whereas OS means the left eye. OU means both eyes. Similarly, this term is very used. PO means the per oral, means by mouth. If any drug is taken by mouth, right, like PO. Then S is without. Then there is SL, means the sublingual. If any therapy is taken as, any drug is taken as sublingual, it's written like SL. Then there is a top, means topically. If any preparation is applied topically, especially for the creams, some preparations like creams, ointments, so they are applied topically. For that, TOP is written. Now, if these terms are used, which we are using the abbreviations form, the short forms. So, at the time, what happens, there are the chances of medication error. Chances of medication errors. And to reduce the medication errors, there are some of the points we'll discuss here. Point number 1, what a pharmacist or a physician can do, show a whole number. Always write the whole number with no decimal point or terminal 0. So, I can take an example here. Express 4 milligram as 4 mg, not 4.0 mg. So, it's a common sense. Of course, there's nothing like us to write 4.0 mg. We can write this as 4 mg. Now, show the quantity is smaller than 1 with 0 preceding the decimal point. If any quantity is less than 1, so we can write like 0.2, 0.1, 0.3, like this. There is need of the space between a number and unit. So, if any dose is like 1 mg, don't like this, this is wrong. We will write 1 mg. So, there should be space. This is written in the point number this. Leave a space between number and unit. Another is use whole numbers, not decimal fractions when possible. So, it is written like 100 mg. If we can write it as 100 mg, so don't write it as 0.1 mg. It's written here, point number this, don't abbreviate drugs names. Means if any drug is, we are writing magnesium sulfate. So don't write MgSO4. We can write magnesium sulfate. So there are the chances we are trying to reduce medication errors here. Similarly, there are others. Spell out the word units. If we are writing like 100 units. There is one method we can write 100 units like this. Another method is 100 units. So which is right? Of course this is right, because there are the chances of medication error here. So spell out the words unit, means we are using 100 units, not 100U. Another, write about abbreviations that may be mistaken or other abbreviations. So at least try whenever we can avoid these abbreviations, we will avoid, so that there are reduction of the medication errors. Amplify the prescriber's directions, means if a direction is written, here it is an example, write swallow 1 capsule with water in the morning rather than 1 cap in AM. So this information can be misleading to the patient or to the pharmacist or any of the healthcare professionals who is dealing with the therapy part. So at the time a physician can write like this, or pharmacist can tell to the patient like this, write or tell to the patient, swallow 1 capsule with water in the morning. So it should be amplified. Other are the legal requirements. A medication order is legally corrected. So there are some of the points. Point number 1, doctor's name should be there. Doctor's qualification should be there, means MBBS, MS. What is the registration number? It is written registration number with a hospital or a clinic. A doctor's signature or a stamp, it is at the last of the medication order. If this is the medication order, so signature or stamp is there. Then only it is legally accepted. There should be date of consultation. In the prescription part, it is written at what date a patient went to the physicians or to the clinics. So at the time, date of consultation should be there. Details prescription should include the name, gender and age of the patient. So it is written on the medication order, what is the patient name, XYZ, what is the gender, male or female, what is the age, 18 years, 20 years, like this. Now medicine's name, what is the medicine name, what is the dosage. Dosage means if any drug is given, so 20 mg, 40 mg, 50 mg, like this. The directions of use, how to take, means it could be oral, it could be IV. So use of the medicine. Frequency, how many times, 2 times a day, 3 times a day, for how many days. So in the prescription usually written as 5 days, like 6 days, 1 week, like this it is written on the prescription. So it's the duration of medicines prescribed. Then there is a follow-up. Refill information, means how many times a patient can order the drug. Especially this is required in the case where the patient is suffering from the chronic disease, or a patient is taking medication for 3 months, 4 months, 6 months or 1 year. At the time there is a requirement of refill. Now, how long a prescription is valid for? Now question arises, if a prescription is recommended by a physician, it is written by a physician, then how long a prescription is valid? So there are 2 conditions. One condition is for the controlled substance, another is for which is not controlled, so uncontrolled substances, so not controlled. In controlled substances or controlled drugs means the drugs which is causing habit, which is giving habit to the patient, and they have the withdrawal symptoms. So we have discussed the controlled substance, and for the non-control, which we call as a general medicines for any of the diseases. Point number 1, a prescription is valid for 6 months from the date of consultation unless the medicine prescribed contain controlled drug. So for general medicines, it is for the 6 months, valid for 6 months. Another is the controlled substance, it is valid for 28 days from the date of consultation. Why? Because there is a need of proper care, proper monitoring. As they are giving the withdrawal symptoms, they are giving the habit to the patient. So it's important at that time to see the validity. Now legal requirements, the another legal requirements we can see, the prescription is written by the appropriate practitioners. And appropriate practitioners could be of two types. One is independent prescribers. So who will write the prescription? Independent prescribers, or there are supplementary prescribers. So these can write the prescription. Independent prescriber means physician. So only physician will write the prescription to the patient. This means the independent prescriber. Another is a supplementary prescriber. After the first consultation, there is a supplementary prescription. Supplementary prescription means on seeing the therapy, what is actually the therapy. A pharmacist can give the drug to the patient. A nurse can administer to the patient. So this can be written by the supplementary prescription can be written by the pharmacist, the nurses also. This is the basic difference between the independent and supplementary prescription. Independent prescribers, healthcare professionals such as doctors, dentists, nurses, independent prescribers. Pharmacists, independent prescribers, ultimately they are the physician, they are the doctor, optometrist. These all can give the prescription. Whereas another is the supplementary prescribers. They can write the prescription who they are. So see, the supplementary prescribers are responsible for continuing your health. So I told you on seeing the therapy care, after an independent prescriber has assessed, means the doctor has assessed the patient health completely, then they are giving the drug to the patient, and they could be the nurses, they could be the pharmacists, they could be the physiotherapist, the diagnostics, and they usually work with the independent prescriber, means they are working in a team, they are working with the doctors. So we have discussed about the legal requirements of the medication order. What is the validity of the medication order? Who can write the prescription? Here we'll discuss the communication skills required. So communication skills required for the pharmacist. When a pharmacist take on clinical roles, what are the clinical roles? Identifying and reviewing patient medication. So pharmacists are seeing the files of the patient, they are seeing the medication chart of the patient, and they are providing medication counseling to the patient. Sometimes what happens, the patient is suffering from the chronic disease, a patient is coming to the pharmacist is providing the patient counseling. At that time, communication skill is required. It is very important that the pharmacist should understand the problems of the patient, they should understand the language of the patient and try to tell to patient about the therapy, so to maintain the outcomes. Offering information about medicines, or any adverse reaction monitoring, as the pharmacists are also working for ADR monitoring. At that time, because they have to directly communicate with the patients, communication skills are required. Interpersonal communication skills are critical because they are talking to someone else. At that time, interpersonal communication was more important. To be professionally effective, to maintain the effectiveness in professional way, a pharmacist will need to be aware of, there's 2 or 3 points, we'll discuss the point number 1, the different messages they are sending. So any of the information they are getting from the patients, how they will communicate to the patient, how these could be perceived. So sometimes what happens, if the patient is actually not understand the language of the pharmacist use visual charts, or try to speak in the language which actually a patient is understanding. If it could be Hindi, it could be English, or any simple language. How to interpret this and how misunderstanding can occur. And sometimes what happens in communication, misunderstanding happens. So it's important to take feedback from the patients also. Yes? Without a feedback, communication is not completed. So, in the communication skills, as we have discussed, what is the roles of the pharmacist and how they are communicating. So, at that time, there could be the communication with the prescribers, there could be the communication with the nurses, there could be the communication with the local pharmacist, or the healthcare professionals, or any of the members. So, what are the basic we can say areas where they are communicating with the prescribers. So point number 1, with the physicians, they are resolving and preventing medication related problems. Yes. So there could be any problems, there could be the problem with the side effects, there could be the problem with the adverse drug reaction. A patient is taking any of the therapy and there is an adverse drug reaction. What happens? Of course, need of change of therapy. There is a need of change of dosage. Yes. So these could be the steps can be taken after the side effects, the adverse drug reaction. There could be the precautions. So they are resolving these issues with the physicians in a team. Spoken messages can occur in person or over the telephone. Of course, the information can be passed with a direct contact or with a telephone. They are used to obtain information about the patient and their treatment. They are providing medicine information to the practitioner, means doctors, or clarify or recommend modification in the patient therapy. I told you these are the modifications in the patient therapy. Now, skills and confidence is required in handling difficult situations, because if there is no skill, if there is no confidence, of course, the patient will not take it as the modifications, or physician will not take it as modifications in handling difficult situations. And initially we developed through role plays. When initiating a telephonic conversation, an effective skill is maintained. Some control of the process by keeping the content focused. Content should be focused, and ending the call when the purpose is achieved, only after by taking the feedback from the patient. Now, communication with patients. So they are in the previous slides we have discussed, they are communicating with the physicians as well as the patient's problem. Here they are directly contacting with the patients, either by telephone or by face-to-face communication. So pharmacist providing patient care with varied responsibilities in a variety of practice settings. Now, pharmacist clinical expertise, they have more information on the knowledge, they have more information on drugs. Access to patients, they have access. And in the retail setting, it is seen when a patient comes with a medication order, pharmacist is telling about which medication a patient should take in, what is the dosage written here, and what is the follow-up period time. If any side effects or adverse effect is reported, then the pharmacist will tell it to the doctor, try to change the or modify the therapy. Place them in unique position to improve health outcomes, and ultimately in whole of the process, whatever the communication a pharmacist is doing with the physician, with the patients, with nurses, the main goal is to improve or to increase the health outcomes. Health outcomes means to reduce the hospitalization and I can give an example, like if a patient is suffering from any viral infection or a bacterial infection, and patient has taken a therapy for 5 days. So what is the health outcome? Of course, the health outcome will be after the 5 days, the patient will be cured with this viral or a bacterial infection. So ultimately, whole communication, the goal of the whole communication is to improve health outcomes. So the patient actually understands what is the therapy, what is the use of the drugs, which is written in the medication order, for how many days it is. If any side effect is reported, of course, go and tell to the pharmacist, and the pharmacist then next will communicate with the physician. Then this is one of the chart here. It is showing that how pharmacist communicating with the patient. So there are some of the areas. This is the goal, we can see. Here is the pharmacist's responsibility, and these are the communication skills. Now, first goal is the foster the relationship. So when patient will actually understand whatever the pharmacist is saying. Before this, it's very important to maintain the relationship between the patients and pharmacist. So what is the responsibility of the pharmacist? We can see. First, build a rapport. Another is appear open. So ask open-ended questions. Demonstrate respect. Yes, this is very important, as we have also discussed in the code of ethics. Demonstrate caring. Caring should be there with the patients, and there should be the commitment. Yes. Acknowledge feelings and emotions, means the pharmacist should be empathetic. So he or she should understand the feelings of the patients, feelings and emotions of the patient. For all these points, for maintaining rapport, to understand the feelings and emotions, what is required? These communication skills are required. So first, a pharmacist will greet patient warmly. Then only a pharmacist can develop a rapport. Yes. So when a pharmacist will meet warmly with the patient and appropriately with the patient, maintaining the eye contact, showing the interest in the patient's problems, listen actively and express empathy, means acknowledge feelings and emotions. So all these are required for maintaining this goal, foster the relationship. To maintain the relationship between the pharmacist and the patient, it's very important to do all these steps. Yes. Now there is, as a pharmacist develop a rapport between the patient, what happens? There is a gather information. So pharmacist will ask the questions and will tell the purpose of the counseling. So here a pharmacist's responsibility is determine purpose of encounter. Yes. Discover biomedical perspectives. What is the disease the patient is suffering? What are the issues with the patient? And what actually the patient is? What the patient's perspective with the disease? What the patient perspective with the therapy also? Sometimes what happens, patient actually don't understand about the therapy. They actually think when they will, there is a therapy of the 5 or 10 days, or patient actually take it for the 2 days, and if there is a relief of the sign and symptoms, patient will not take. So there are some of the perspectives. So we try to see these perspectives here. And for all these steps, as these all are the responsibilities the pharmacist is doing with the patients, for these communication skills are required. What are these communication skills? Pharmacist will ask open-ended questions, means which is long questions. They are trying to understand the psychology of the patients. Allow patients to complete responses. Clarify and summarize information. All the information, means the gathering, they are gathering the information. Exploring impact of illness on the patients. So in this step, the pharmacist is telling the patient about their disease, about the therapy, and taking the information from the patients also. Another is providing information. So in the previous section we have discussed the pharmacist is maintaining the relationship, then they are gathering the information from the patient and also telling to the patient. In the another step, the pharmacist will speak everything, will tell everything about the therapy. So in this, the pharmacist's responsibility is identify patient informational needs. What is the needs of patients? They are understanding from the previous section we have discussed. By gathering the information, they are trying to understand or identify the patient informational needs. They are sharing information, they are overcome health literacy, the barriers. I told you there are some of the barriers which could be intentional, unintentional. Sometimes what happens, from the cost basis, the patient is not able to take the medication. Sometimes what happens, the patient forgets to take the medication. Patients understand that there is no need to take medication if signs and symptoms are cured. So these all points will be clear from the patient's mind also. For that, speak plainly and don't use the difficult words the patient is not able to understand. Use the simple words. Encourage questions. So try to encourage the patients. They can ask the questions, they can ask any of the query and try to clear them. So check the understanding. For checking the understanding, we'll discuss in the later part. there is a shared decision making. In shared decision making, what happens is some of the alternatives physician is giving to the patients, and at the time there is a need of the decision on that alternatives. The patient can select any of them. So that's a need where the pharmacist is maintaining the autonomy and dignity. So identify patient goals. What are the goals of the patients? Means to treating hypertension or diabetes or any of their disease. Outline collaborative treatment plan. What plan should have? This is the responsibility in this section. Shared decision making. Here they are exploring the patient preferences. So I told you there are different alternatives for a particular treatment. A patient can select any of them. Try to reduce the barriers to the treatment choices. Another is enable treatment success. In this step, they are summarizing treatment plan. Yes. So all of the information they have gathered, they summarize. The pharmacist will summarize the treatment plan. This drug is taken for the 5 days or 6 days. If a patient has a problem with any of the drugs, they will communicate with the doctors and will modify these drugs. So elicit patient understanding. They will see what the patient actually understands and discuss the follow-up. Here feedback comes in role, feedback, and another is the follow-up. Why follow-up is needed? Of course, the patient can suffer from any of the side effects, any of the idiosyncratic reaction, any of the adverse drug reactions, of course. At the time, or therapeutic drug monitoring is needed. If the patient is suffering from any of the chronic illness, at the time follow-up is needed. So these all the areas are here where the communication skills are needed with the patients. Thank you so much everyone. I hope you all got this, and we'll meet in the next session.